amazing parents. It's Dr. G, your go-to board-certified pediatrician and mom. Today, we'll be discussing a topic that's both exciting and a little bit messy. Starting solids for your infants. This is a big milestone in your child's life. So grab a bib and let's dive right in. When to start salads. When should you introduce salads to your little one? A great question. The American Academy of Pediatrics recommends starting salads around 6 months of age. This is because by this time, most infants have the necessary oral motor skills and gastrointestinal maturity to handle them. Additionally, introducing salad foods too early may lead to an increased risk of obesity and other health concerns, while waiting too long may result in nutritional deficiencies, especially in iron and zinc. However, each baby is unique and some might be ready earlier or later. It's essential to look for developmental milestones rather than just focusing on their age. Okay, so developmental milestones showing solid food readiness. Keep an eye out for these signs that your baby is ready to take the plunge. Number 1, your baby can sit up well without support. This is important because it helps prevent choking, as your baby can swallow more effectively when sitting upright. Number 2, your baby has good head control. This means your baby can hold their head steady without wobbling or falling forward, which is crucial for safe swallowing. Number 3, your baby shows interest in food, like watching your plate, reaching for your food. This is a sign that they are curious and eager to explore new tastes and textures. Number 4, baby has lost the tongue thrust reflex. Infants are born with a reflex that causes them to push their tongue forward when something enters their mouth. This is a natural reflex which helps babies from choking on milk, but it can make it difficult to swallow solid foods. When your baby starts to accept spoonfuls of food without pushing them out, it's a good indication they're ready for solids. Nonetheless, always consult with your child's pediatrician before starting solids to ensure your baby is developmentally ready and to discuss any specific recommendations or concerns tailored to your little one's needs. Next up, which foods to start with. Now that we know the signs of readiness, what should be your baby's first foods? This is where things get exciting, but remember, there's no one-size-fits-all answer. As a guideline, here are some common first foods that you can offer your baby. Number 1, pureed fruits and veggies, such as sweet potatoes, applesauce, or pears. These offer a range of different flavors and nutrients, helping your baby to start developing their palate. Plus, the puree texture is gentle on their developing digestive system. Number 2, avocado. I love it. Let's talk about the superstar that is the avocado. It's rich in healthy fats, especially monosaturated fats, and it makes an amazing first food for your baby's brain development. They're also creamy and easy to swallow, which makes them perfect as a candidate for one of your first solid foods for your baby. Fun fact, my daughters had avocado as their first solid puree. Did they love the avocado and breast milk combination, you might ask? Not at first, but I loved watching their faces. Number 3, single grain cereals like rice, oatmeal, or barley. These are often recommended as the first foods because they are easily digestible and fortified with iron, which is an important nutrient for babies at this age. However, you don't have to start with a single grain cereal, especially if your infant is taking a multivitamin which contains iron. If you do choose a cereal, remember to mix it with breast milk formula or water, which creates a thin consistency that your baby can easily swallow and avoid, I would recommend avoiding multigrain cereal so that if your child is having an adverse reaction to a grain, it will be easier to identify. While we're on the topic of food safety and allergies, it's a good moment to discuss recent research regarding allergenic foods. For many years, it was recommended to delay the introduction of potentially allergenic foods such as peanuts and eggs in infants to prevent food allergies. However, more recent research suggests otherwise. According to these studies, introducing allergenic foods as early as 4 to 6 months while continuing to breastfeed may actually help to reduce the risk of developing food allergies. It's important to note that this should be done only under the guidance of your pediatrician, particularly if there is a family history of food allergies or if your baby has severe eczema, which can put them at an increased risk of food allergies. And that's a whole topic that we can do on another video. With any food, always start with one food at a time and wait 3 to 5 days before introducing a new one. This will help you identify any potential allergies or intolerances. If your baby has a reaction to a new food, stop feeding that food and consult with your child's pediatrician. Remember, starting solids is a gradual process. Your baby is getting most of their nutrients from breast milk or formula during this stage. Solid foods at this age are more about learning and exploration than nutrition. I like to say food before one is just for fun. Also, you may find that your baby makes some pretty funny faces when trying new foods. That's okay. They're just getting used to the new flavors and textures. Don't be discouraged if they reject foods at first. Just keep trying. It can take many attempts before your baby will accept a new food. This is perfectly normal and part of the learning experience. Next up, understanding stages of solid foods. Consistency matters. Now that we have an idea of the types of foods to introduce, it's equally important to discuss the progression of food. Consistency. Understanding the stages of solid foods can make the transition smoother and safer for your baby. Stage 1, thin purees. We start here, around 6 months of age, with thin single ingredient purees. These are smooth with no chunks and are the easiest for your baby to swallow. Think thin, soupy-like consistency. Stage 2, thick purees. As your baby gets used to the new world of solids around 7 to 8 months, you can gradually move to a thicker puree or well-mashed food. These still don't contain chunks, but are denser and require a bit more work for your baby's mouth. Stage 3, thick purees with chunks. Once your little one has mastered thick purees, the next stage usually involves thick purees that include small, soft chunks. Stage 4, finger foods. Around 9 to 12 months of age, or when your baby has developed a good pincer grasp, you can introduce finger foods. These are small, bite-sized pieces of soft food that your baby can pick up and eat themselves. It's a great way for them to develop their fine motor skills and enjoy a bit of mealtime independence. So, I can't talk about consistency without discussing baby-led weaning, which is a different approach. So since we've discovered the stages of introducing solids and we've touched upon finger foods, I'll just go and discuss this different method briefly. Gained quite a bit of popularity in the most recent years. Baby-led weaning, or BLW, is an approach where you give your baby the chance to feed themselves right from the start of introducing solid foods. The term weaning here, though, is used in the British sense, meaning introducing solid foods, not stopping breastfeeding or formula. In this method, instead of starting with purees, babies are given soft, manageable pieces of whole foods, and they decide what, how much, and how quickly to eat. The food still should be easy for the baby to grasp and soft enough for them to gum, mash, or break down. So, what are the potential benefits of this approach? Number one, developmental of fine motor skills. Since your baby is feeding themselves with their fingers, they get to work on their grasp, hand-eye coordination, and chewing skills. Number two, independence and self-regulation. Baby-led weaning can foster a sense of independence in your little one and help them learn to self-regulate their food intake. Number three, expanding palate. Since your baby is eating the same foods as the rest of the family, in theory, it can encourage them to enjoy a variety of flavors and textures, which could potentially set the stage for healthier eating habits in the future. So, what are some of the cons or things to keep in mind when thinking about baby-led weaning? Number one, which is a huge one, is choking risk. Although proponents of BLW argue that the risks isn't higher than traditional methods, it's absolutely crucial to prepare foods in a way that your baby can safely chew and swallow. Like, safely chew and swallow, please. Thank you. Number two, mess factor. BLW can be a bit more, let's say, interactive. It's food to be explored, squished, thrown, and remember, it's all a part of the learning. If you're considering BLW or baby-led weaning, I want you to discuss it with your child's pediatrician. They can help you understand if your baby is ready for this approach and provide guidance on safe foods to start with, which is so important for me. But whether it's traditional salad purees or BLW, the goal is to make mealtimes enjoyable and nutritious for your baby. Remember, every baby is different. Some might enjoy purees for longer, while others may show an early interest in self-feeding. Trust your instincts and your baby's cues and consult with your child's pediatrician if you have any concerns. And that's a wrap for part one, parents. We've covered a lot today, from signs of readiness, first food options, to baby-led weaning. But hold on, there's more to come in part two. We'll dive deeper into what foods to avoid, the debate between jar foods and homemade purees, plus some top tips for a smooth transition to solids. If you haven't already, please hit that subscribe button so you won't miss the next part of our exciting adventure into solid foods. If you found this video helpful, don't forget to like, share, and leave your comments or questions below. I'd love to hear your thoughts and experiences. Until then, take care, enjoy these precious moments with your little one, and get ready for more delicious adventures in part two of our journey into introducing solid foods. Bye.